In health news, a life-changing new device is helping patients with irregular heartbeats. It's called the Watchman, and it is now being offered to patients right here in our area at MedStar Washington Hospital Center. Joining us now is the hospital's director of the Cardiac Catheterization Laboratory, Dr. Lowell Satler. Did I get that right?
Thank
Catheterization?
You. Yes, perfect.
Okay.
Perfect.
All right, so this is brand new. You said within the last month or so.
Correct.
All right, we've got it here. We're going to try and get a shot on it because it is a tiny little thing. It's called the Watchman.
Correct.
Why does it have that name, and how does it work?
So it's for patients that have an irregular heart rhythm known as atrial fibrillation.
Okay.
This occurs in about 5 million Americans, and it's an epidemic. By the year 2050, we'll have twice that many.
Okay.
It's associated with stroke in up to 20% of patients with atrial fib.
Okay.
Typically, people take blood thinners, but there are problems with blood thinners. Sometimes people would bleed on a blood thinner.
Right.
They can have a hemorrhage on a blood thinner. And so this is a device that's an alternative to taking the usual blood thinners.
So we've got a close shot of it now. I want to just point out that this is what it is. It's a tiny little thing, and it kind of almost looks like a parachute.
Correct.
So how does it work?
So it's constrained. It's placed from a vein in the leg, and we negotiate it into the heart using ultrasound and X-ray. We position it into a small segment of the heart known as the left atrial appendage.
Okay.
And then we release the cable, and the device fills the tiny little hole known as the left atrial appendage. The left atrial appendage is often the focus of a clot. And if you have a clot in the left atrial appendage, it could break off and cause a stroke. So this basically is a cover that seals the opening of the left atrial appendage. The procedure takes about 1 to 2 hours to do.
Okay. Is this an outpatient procedure?
It requires an overnight stay. And then the patient recovers. They have to be on blood thinners for about a month after the procedure is completed to allow sealing of the device. And after that, most patients don't have to take blood thinners anymore.
So you put it in through a vein in the leg, and then it manages to maneuver its way up to the heart?
Yeah, if you look at it, it actually can be constrained, so it's very narrow and very thin.
So and then you kind of almost pop it open as if an umbrella.
It opens up, it releases. You remove the constraint, it pops in, we position it, we're using X-ray and ultrasound, and then it stays.
Okay. So you said that these heart arrhythmias and these irregularities are becoming a bit of an epidemic here. Who would be a good candidate for this?
So you have to talk to your doctor if you have atrial fibrillation to see if you're at an increased risk for bleeding. Those are the candidates that would be perfect for the device.
Okay, so somebody who doesn't need to be on a blood thinner.
Someone that has to be on a blood thinner, correct, but may not be able to take it. So it might be a frail patient or elderly patient that falls a lot, someone who's at falling risk, someone who has trouble taking medicines, has a medication adherence problem. Those are the types of patients that would benefit the most for the device. So
somebody watching, is this something they should go in and ask their doctor about?
They should talk to their doctor if they have atrial fib and see if it's appropriate for them. And then we can talk to their doctors to see if this would be a good device to help them manage their arrhythmias and hopefully prevent stroke.
And is this something also that might take the place of a patient needing a surgery?
So most of the time for atrial fibrillation, we don't do surgery to prevent clots from forming. So this is really a device that replaces the medicines that they were taking, the blood thinners, and reduces the risk of stroke and bleeding.
Why the name the Watchman?
That's a good question. I don't know.
You didn't name it.
I didn't name it. It's a good question.
Okay. Well, still a great device that gives a lot of people hope that don't need to be on these blood thinners. Dr. Satler, thank you so much for coming in and talking with us.
Thanks for having me.
Appreciate it.